Hello everyone, welcome to our channel Students Homeopathy and let's learn together. Kant's philosophy is one of the important manuscripts of homeopathy. Understanding Kant's philosophy increases one's depth and acumen in homeopathy. In this video, we will discuss lecture 7 from Kant's philosophy, that is Indispositions and the removal of their cause. So, what are the indispositions? Indispositions are the apparent diseases or the disturbed states, but not the real disease. They mimic the miasms, that is, they produce the group of symptoms which are the imitation of miasmatic manifestations. That means, the symptoms produced by the indisposition are exactly the same or the copy of miasmatic manifestations, but indispositions are not the real miasm. The apparent or occasioning cause of indisposition is the exciting causes, but the active cause is within, that is the miasmatic cause. Without having Psora within, one cannot suffer from indisposition despite the exciting causes, as there will be an ordered state. However, in indisposition, the removal of the maintaining or exciting cause is likely to restore the patient to health. For example, a businessman having Psora within may become insane from business failure. A young girl who has Psora within may suffer from disappointed love. These are all indispositions. In both of these cases, they would better handle the situation if they had no Psora. The businessman would throw all the business cares and the young girl would take the disappointment easily. Usually, the indisposition gets removed by itself without any medicinal aid if the exciting causes are removed. However, if the psoric state within is disturbed somehow, a few doses of homeopathic medicine is necessary to restore the health. For example, if a man has disturbed his stomach by overeating or taking rich and spicy foods, he must stop it to get his health. However, if despite it the suffering is prolonged, a few doses of homeopathic medicine, that is, you can say Nuxbom, Pulsatilla, etc., according to symptoms is necessary for restoration to health. Then, examples of some indispositions and their removal. Strong smelling flowers that have a tendency to cause syncope and hysterical sufferings should be removed from the room. Sensitive, nervous girls fainting from the odor of flowers, the flowers should be removed. Individuals unable to live in the ordinary atmosphere because of Psora must be sent to the mountains or warm lands or cold lands wherever they feel better. A conservative in the advanced stages who is steadily running down in his climate must be sent to a climate where he can be made comfortable. So in these two cases, the physician sends the patient away not for the purpose of curing them, but only for making them comfortable. By this, the external or apparent cause or the disturbing cause in his sick state is removed, but the cause of his sickness is not removed, which is prior to it. Likewise, foreign body in cornea that excites inflammation of the eye, it must be extracted from the cornea. Overtied bandage on a wounded limb threatening to be gangrene or necrosis must be made loose. Wounded artery leading to hemorrhage and fainting must be ligated. For swallowed poisonous substances like belladonna berries, endeavor must be made to promote their expulsion, that is by inducing vomiting. However, note that Hahnemann never advised emetics in treatment of diseases. He advised it only to remove this type of occasioning causes in disposition. Now, Dr. Kant proceeds further to discuss the treatment of the old school. Out of a number of symptoms in a disease, the old school physicians only treat the single symptom and suppress it. For example, they prescribe medicines for cough only, vomiting only, They do not consider the whole disease, that is, the patient as a whole. They treat in the name of heart diseases, liver diseases, etc., and refer to different specialists in those systems who prescribe medicine for that particular system only. Thus, the patient goes the rounds of all the specialists and then dies. They cure pneumonia, but the patient progresses towards death. Then, examples of some of the treatments of old school: removing constipation by physic, temporarily removing liver symptoms by large doses of calomel. Such suppressions do not cure the patients, but make them worse. However, only the weak ones among them will face the bad consequences immediately. The more robust patients live a much more time before they break down. For example, the closure of fistulous opening in a weak or physical patient leads to death within 1 or 2 years. But the more rugged ones sustain it for a number of years. According to Kent, the fistulous opening is formed because it has some use. That is, it acts as a vent to drain the pus and other materials. Thus, once the patient is cured, there will be no need of draining and the fistulous opening will be healed up by itself. There is no principle in organon that directs removal of external manifestation of disease by external means. Then, what are the Psoric cases? A Psoric case is that which has no external or traumatic cause. If, despite maintaining all sorts of orderly life like not using tea and coffee or taking only small quantity of them, taking balanced diet, removing all the external factors that can be a cause of indisposition, etc., one remains sick, then it is a Psoric case. When there is no manifestation of exciting or maintaining cause, that means no indisposition, and the physician perceives nothing but only signs and symptoms to treat the case, it is a Psoric case. For cure, Psoric cases need internal remedy. The intelligent physician will form an image of disease by viewing the array of signs and symptoms in patient and can rely upon it for the purpose of cure. So now, what a physician should know to be successful in his practice? Homeopathy has two parts: science of homeopathy and art of homeopathy. The science of homeopathy includes knowledge relating to the doctrines of cure, knowledge of principle or order, that is physiology, knowledge of disorder in the human economy, that is pathology or the science of disease, however it is not morbid anatomy, and then the knowledge of cure. The art of homeopathy is the application of science of homeopathy in practice. Being academically learned or self-taught, there are many who are famous and scored excellent in the examination. They have learned the science of homeopathy, but only those who are able to apply them in practice or the art of healing know the art of homeopathy. The nature of quality of diseases can be studied from the symptoms of disease itself and the mathematics or the symptoms of proving. The true knowledge of diseases can be got through being acquainted with and understanding the nature and quality of remedy, its appearance, its image, and its relation to man in his sickness from mathematics, that is, drug proving, and then by comparing the symptoms with the symptoms of sick. There are some who know the science of homeopathy but are unsuccessful in its practical application. They are unable to prescribe the right simillimum. According to Kent, only those who have candid love for the work and who heal for the sake of love of healing are the most successful homeopathic physicians. They will verify their knowledge for they love it. Here, He has compared a successful homeopath or a homeopath knowing the art of homeopathy to an artist or a painter. According to him, as like a painter first mixes the colors in his mind before he could mix it on canvas, and as like he figures out the pictures in his mind day and night from his very affection, the homeopath should likewise love and give attention to their practice. The painter loves and stands before his picture to get delighted. The homeopath should also get that much delight in prescribing and curing the sick individual. As he learns to love his practice and dwell upon it as the very life of him, he understands it as art and can apply it in the highest degree. Lack of affection for homeopathy will lead to superficial intelligence and memory only. It will not form the real image of disease. If the symptoms do not take form, then the physician does not know his patient and thereby does not know his remedy. Memorizing symptoms or memorizing keynotes or learning prescriptions only as a memory are merely a mass of information having no application. For cure, totality of symptoms must be considered, and the cure should be from above downward, from within outward, and in the reverse order of coming of the symptoms. So let's summarize all this. Indisposition are the apparent diseases or the disturbed states, but not the real disease. Indispositions mimic the miasms. The apparent cause of indisposition is the exciting cause and the active cause is the miasmatic cause, that is Psora. Removal of the maintaining or exciting cause is likely to restore the patient to health in case of indisposition. There is no need of medicinal aid. However, if the psoric state within is disturbed somehow, a few doses of homeopathic medicine is necessary. Out of a number of symptoms in a disease, old school physicians only treat the single symptom and suppress it. In weak ones, such suppression leads to bad consequences immediately, but in more robust patients, it takes a much more time before they break down. A psoric case is that which has no external or traumatic cause. For cure, psoric cases need internal remedy based on totality of symptoms in patient. Homeopathy has two parts, that is science of homeopathy and art of homeopathy. The science of homeopathy includes knowledge relating to the doctrines of cure, knowledge of physiology, knowledge of pathology or the science of disease, and the knowledge of cure. The art of homeopathy is the application of the science of homeopathy in practice. Academic learning can make one learn the science of homeopathy, but the art of homeopathy is known only to those who are able to apply them in practice. The nature of quality of diseases can be studied from the symptoms of disease and the symptoms of proving. Only those who truly love their practice and heal for the sake of love of healing are the most successful homeopathic physicians. Memorizing symptoms or memorizing keynotes or learning prescription belongs to the science of homeopathy, but it is not the art of homeopathy. Cure should be from above downward, from within outward, and in the reverse order of coming of the symptoms. So that's all for this video. If you have not yet subscribed to our channel Students Homeopathy, please subscribe it now and also click on the bell icon and select all so that you will not miss any of our informative, educational and interesting videos on homeopathy. Please provide your valuable feedback in the comment section. Also, we will love to answer your queries on this topic. Thank you for watching.